I want to talk about the death of the genetic theory of disease transmission today. And I want you to call your young giving associate and get my new book, Epigenetics, The Death of the Genetic Theory of Disease Transmission. And, of course, there's a DVD that goes along with it. Somebody needs to go to jail. And then the CD is Public Enemy #1. And you have to appreciate that over the thousands of years since the Egyptian pharaohs and kings of those days, there's been thousands of failed medical theories every century. And the 20th century and 21st century are no different. When you look at things like, birth defects, things like cystic fibrosis, muscular dystrophy, sickle cell anemia, Down syndrome, all of these birth defects are simple nutritional deficiencies of the embryo early in pregnancy, okay, including deafness, congenital deafness, kids are born deaf. All these are nutritional deficiencies, have nothing to do with genetics. And then you have high blood pressure. You have cancer, Alzheimer's disease, heart attacks, heart disease, and so forth. None of these are caused by genetics. They're all caused by nutritional deficiencies. And, of course, you throw in some inflammation to make the nutritional deficiencies worse. Okay, so let's start out with birth defects. Okay, this is the beginning of life for most people, where you are conceived, and then you have to go through pregnancy, and we're given genes. We're an XX female or an XY male as soon as the egg is fertilized by the sperm, and we're given half of our chromosomes from the father and half of the chromosomes from the mother. And everybody assumes that these good genes, including the doctors and scientists, genetic scientists, believe that genes are autonomous, and they're going to do what they are going to do regardless of what raw material they get or don't get. Well, the science of epigenetics, which I'm considered one of the fathers of, says that, in fact, your genes are just something with potential. And to maximize your genetic potential for longevity and for health and fending off disease and things like speed and strength and making good decisions and so forth, you need to give your genes, your DNA, your RNA, your telomeres, little end caps in your chromosomes, all 90 essential nutrients every second of every minute of every hour of every day of every week of every month of every year. Okay? Particularly right at conception. And so the mother needs to be getting these things for, say, every day in optimal amounts for 6 months a year, better yet 5 years before she conceives, all through the pregnancy you're developed in, from the moment you're born, and for the rest of your life. And you're going to get maximum benefits. You're going to maximize your genetic potential. Now, if you don't get these nutrients, guess what? Your genes can't function. Your DNA and RNA can't function at optimal levels. And so you wind up with all these diseases. Well, this is where the book Epigenetics really covers this in some great detail. And I urge you to read this book, Epigenetics. It'll show you how we can do so many things. People say, well, you're saying outrageous things. You're saying we can make America a type 2 diabetes-free disease in 2 months or less. We can make America a obesity-free country in just a couple of months. I mean, we've been fighting these things for hundreds of years. How can you say that? Well, because of failed medical theories. Same way with, for instance, let's say heart disease. Congestive heart failure, one of the most common causes of heart death in adults, is not caused by bad genes. It's caused by a deficiency of a single vitamin. We've known it for 300 years. It was discovered by a Japanese naval surgeon 300 years ago. And then cardiomyopathy heart disease. I've done 1,700 autopsies on kids under the age of 10 who've died of this one. And this is what causes sudden heart death in athletes and people who do hard physical work. And this is actually caused by deficiency of a single mineral. And then there's coronary artery disease. This is not caused by cholesterol and saturated fat. Okay, that was all the sales campaign to sell a product for Procter & Gamble. Procter & Gamble gave the American Heart Association $1.7 million in the early 50s to, in fact, endorse this new product Procter & Gamble wanted to sell, which competed with lard and cream and butter. And so they had to demonize lard and cream and butter, which every grandmother and mom had used for cooking for hundreds and maybe even thousands of years. And so they had to kind of break this cycle of using those things. And so the American Heart Association demonized the cholesterol and saturated fat, which came from lard, cream and butter, and meat and dairy products and so forth, cheese and so on, so that Procter & Gamble could sell this product called Crisco. Okay? This whole thing about the Mediterranean diet and demonization of cholesterol and saturated fat was a sales campaign to sell Crisco. Well, what did we get for that? Well, we're dying younger and younger and younger, and the experts are saying that our kids will be the first generation of Americans that do not live as long as their parents. Ask Joe Biden how it felt to, our vice president, how it felt to bury his son Beau at age 47. What you think of somebody like Steve Jobs? What did his parents think? And he died at 56. Iwata, the CEO of Nintendo, another billionaire, dies at 55. Okay? And just there was a son of a king in Dubai who just died at age 33 while he's exercising. Okay? I mean, this is a king's son. He lives his whole life eating well and having exercise and getting the best medical attention, and he drops dead of a cardiomyopathy heart attack at age 33. That's because they don't have the nutrients. Get a hold of the book Epigenetics, the CD, Public Enemy #1, and the DVD, Somebody Needs to Go to Jail, and learn how you can protect your family, protect your loved one, and then as a side effect, we'll protect America. We'll be back with Dead Doctors Don't Lie after these messages.
You may have heard about the 90 essential nutrients or the Mighty 90 needed for good health. But with all the products out there, what exactly are they talking about? The Mighty 90 is 16 vitamins, 12 amino acids, 60 plant-derived minerals, and 2 essential fatty acids. So now you know. But with all the products you see and hear advertised, what exactly do you buy to come up with the Mighty 90 and the right ratios to promote good health? Longevity has made it easy with the Healthy Start Pack, which contains 1 canister of Beyond Tangy Tangerine Vitamin and Plant-Derived Mineral Complex, 1 bottle of Bone and Joint Enriching OsteoFX Plus, and 1 bottle of EFA Plus Essential Fatty Acids, all in the proper ratios to promote good health and vitality. If you'd like to learn more about nutritional supplementation, call your local longevity associate, and don't forget to ask about home-based business opportunities.
Hey, if you're like me, your life is hectic. You don't know where you're going to be next. Between kids and family and in-laws and work and traffic and everything else that's driving me crazy right now, my life is insane. I bet your life's insane as well. When do we have time to get every single nutrient we need to be healthy? When? Well, I've got a tip for you. Take a product called Pollen Burst. It's so simple, even I can do it. All you have to do is open the package, pour it in water, mix it up, and bam, you're ready to go. It tastes great. It's not one of those medicine tasting things. It tastes great, low in calories, helps curb your appetite, gives you natural energy that doesn't let you crash, gives you your vitamins, minerals, nutrients, everything from the plant world. And I gotta tell you, for a busy person like me or a busy person like you, we need simple, we need good. Pollen Burst is your answer. Tastes great. Try it, and you'll feel better.
Call your local longevity distributor to find out how Pollen Burst can make you feel better. And don't forget to ask about home-based business opportunities.
Okay, Doug, what pearls of wisdom do you have for us today?
I thought we'd talk a bit about menopause, as I have a story here where it says vitamin D may help rebuild muscle after menopause. They say consuming vitamin D may help reverse muscle mass loss in postmenopausal women, according to researchers at the Botucatu Medical School in São Paulo State University in Brazil. They say scientists have debated the benefits of vitamin D for postmenopausal women. The authors of the current research saw a 45% increase in muscle strength in women receiving supplements over the study's 9-month period, and compared to 23% loss in the control group. Women in the control group also, on average, had a 6.8% muscle mass loss. The supplement group had no loss. According to the lead author, Dr. L.M. Kengisu, says this amount of strength gain was above our expectations. They say menopause causes hypoestrogenism, causes decreased strength and muscle mass. This loss of muscle mass and strength leads to increased risk of falls and fractures. This is all presented at the 2015 annual meeting of the North American Menopause Society. It consisted of 160 women ages 50 to 65. Women in the supplement group received 1,000 IU cholecalciferol from vitamin D3 daily. Team used vitamin D3 because it has the highest absorption rate in the body, leads to quicker benefit compared to other forms of vitamin D. According to the National Institute of Health, they say vitamin D is a fat-soluble vitamin that is naturally present in foods and is produced when ultraviolet rays hit the skin and start synthesis. Body uses it to promote calcium absorption in the gut. Researchers observed that supplementation, that is, could increase loss of muscle mass in women as late as 20 or 12 years after they have menopause. Authors say that it's the first study to prove that vitamin D supplementation was protective against musculoskeletal complications in younger women. Noted that previous studies were associated with an older population, and they recommend a dosage of at least 800 IU a day. So there you go, Doc, something you've been talking about for years.
I'm waiting for the flourish.
A little slow on the trigger there today.
Oh, you're forgiven. But you're exactly right. So, muscles need all 90 essential nutrients. And, of course, some of the stuff that goes on with muscle strength has to do with calcium ions, just the calcium itself going back and forth across the cell walls of the muscle cells for contraction and relaxation. And so you can see how vitamin D3 plays an important role in the strength of the muscle. And so, again, muscles and all other tissues and organs in the body, all cells require all 90 essential nutrients. And it's sort of like these poor doctors. I mean, they really, really don't get it. And they have to do all these studies over and over and over. And then, of course, in 5 years from now, everybody will have forgotten that study. And they've actually doubled the dosage. They used to recommend 400 international units. Now they're recommending 800 international units, which is a good thing. I like 1,800, okay? 1,800. They're always talking about minimums, and nobody goes outside and sits in the sun anymore. Everybody's inside working on their computers and playing with their Kindles and iPads and iPhones and so forth. And so I really think we may even have to go up to 5,000 international units today because they're expecting a lot of it to come from the sun, and people just are not out in the sun anymore. And so I urge everybody to take the 90 essential nutrients. Don't wait until you have a problem. This is why we say take the 90 essential nutrients before you get sick, before you have a problem. And, myself, I turned 75 in June of this year using American numbers, 76 in Chinese numbers. And I haven't been to a doctor in 68 years. I haven't had any surgery ever. I've never been on a prescription drug. All right. And I supplement with all 90 essential nutrients. I take the Healthy Start Pack, and I also take the I take, I would say, secret sauces for about 12 different diseases, including bone and joint stuff. So I urge everybody to get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and learn how to deal with over 900 different diseases using the 90 essential nutrients. Thank you, Doug. Super as usual. We'll be back with Dead Doctors Don't Lie for these messages. Okay, Doug, let's go to callers.
Let's head to California. And Elizabeth, you're on with Dr. Wallach.
Thank you.
Well, Elizabeth, you're on the air.
Thank you so much for the opportunity. Yes, my dad just got dismissed from the hospital, and he's diabetic, and you can imagine everything going wrong along with that. And I really want to get him started on this program and reverse it if possible.
Okay. Sure. Is he a type 2 diabetic?
Yes, he is, sir.
Okay. And how much does he weigh, you think?
About 160.
Okay. And how long has he had type 2 diabetes, do you know?
About last 7 years.
Okay. So 7 years he's been diagnosed with it. Does he have any other issues, any high blood pressure, arthritis, anything like that? Okay. Does he have hypertension?
Neuropathy. Mm-hmm.
Okay. And neuropathy?
Yes.
And I'm sorry, and what else?
Neuropathy, I'm sorry.
That's right. Does he have any belly issues, any constipation, diarrhea, irritable bowel syndrome?
No. I do know he has a terrible appetite, just terrible.
Does that mean he eats a lot or doesn't eat any?
No, he eats, all he wants is sugar, and he's really not, even though he's 160, very little muscle, it looks like.
Sure.
He has lots of sensation on the left arm.
Let's get going. We're going to be able to help your dad a lot. Okay? This is a Shar thing. Shar, are you there?
I'm here.
Okay, this is really one for you. Here's a guy who's had diagnoses of type 2 diabetes for 7 years. He has type 2 diabetes. He's 160 pounds. He just has terrible sugar cravings, has arthritis, high blood pressure, peripheral neuropathies. What would you do for this guy?
I give him 2 healthy blood sugar packs, and I get him on a gluten-free diet, and none of the bad stuff, And
What did you do for his arthritis and neuropathy?
I give him the glucogel, and for the neuropathy, I give him the Ultimate Daily and the Cardio FX and the Cardio Sticks.
Okay, that would be for the high blood pressure also. Very, very good. And Char's exactly right here, Elizabeth. Your dad needs to get away from all the inflammatory stuff, no fried foods, no processed meats with nitrates and nitrites, no oils. That includes microwave popcorn, theater popcorn, olive oil, coconut oil, margarine, mayonnaise, just cooking oil, no gluten. We've got to maximize absorption of these nutrients, and she's exactly right. 160 pounds, you should have 2 healthy blood sugar packs, a full dose for him twice a day. Hang on, we'll give you the rest of his program in detail after these messages. Okay, Doug, let's go right back to California and Elizabeth. Okay, just a quick recap here. Shar said you need 2 healthy blood sugar packs per month. That'll be 3 of the sweeties at breakfast and dinner. Also, be sure that he checks his fasting blood sugar every morning before he medicates himself, because he will begin to need to reduce his medication as blood sugar drops. 1 ounce of the OsteoFX Plus at breakfast and dinner. 2 scoops of the Ontane Tangerine 2.0 for breakfast and dinner. 3 of the EFA Pluses at breakfast and dinner. And then I'd have him get about 2 large bottles a month of the glucogel to support and promote maintenance and repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae. So I'd have him take 15 a day, 5 at breakfast, 5 at lunch, 5 at dinner. And then, as Shar said, for the high blood pressure, I'd also have him take the Ultimate Daily tablets, 3 of those twice a day. That's 1 bottle a month. And also the Ultimate Cardio Sticks, 1 twice a day per 100 pounds of body weight. So I'd go ahead and give him 3 of those sticks a day, 1 at breakfast, 1 at lunch, 1 at dinner time. That'll be 3 boxes a month. They come in boxes of 30. And also the Cardio FX, take 3 of those twice a day. It'll be 2 bottles a month. And all that's going to support healthy blood pressure and support healthy blood flow through obstructed arteries. Call us every couple of weeks. We want to know his blood sugar levels, his blood pressure, how his arthritis pain is going, and we'll go from there. Okay, Doug, let's go to callers.
Well, let's head to Los Angeles, California, and William, you're on with Dr. Wallach.
William, you're on the air.
Yes, Dr. Wallach, I'm calling dealing with prostate cancer. They diagnosed me with prostate cancer in 2009, and what I've been doing, I did a little research, and I'm taking shiitake mushroom, pomegranate, and pumpkin seed. And I want to know, is there anything else I can take? Because the doctor that I had then, he told me I had to get another doctor because I wouldn't do the surgery or chemo in 2011. Mm-hmm. And I had to get, I went and got another doctor.
Okay. So how much do you weigh, sir?
225.
Okay. And how tall are you?
5'9".
Okay. Do you have any other issues like arthritis or high blood pressure, diabetes, anything like that?
They say I'm borderline diabetes, and I'm taking some heart medicine for my, they say, what is it, AFib?
AFib, okay.
AFib,
yep.
Yes. I'm taking, I was taking 8 medicine, but I cut it down to 3. And I told my doctor about it. He said, I'm good. He said, I'm good.
Okay, good.
And he said, the AFib is not there now, but he just wanted me to still take it, just in case it came back.
Sure. Okay, let's get going here. Shar, this is another Shar thing. Here's a fella is diagnosed with cancer in 2009. He's been doing some natural stuff and obviously has done a good job. But let's see here. 5'9", I'd like to see him weigh 175, 180, so he needs to lose about 50 pounds. And also we need to support his immune system because his cancer. We need to deal with the AFib and the type 2 diabetes. So we'll come back with Shar here, and she can lay out a program for William after these messages. Okay, Doug, let's go back to California and William. And Shar, again, William is a 225-pound guy, maybe 50 pounds overweight, has a history of prostate cancer, AFib, type 2 diabetes. What would you do for him?
Oh, I would give him 2 healthy brain and heart packs for the cancer, and I'd also add the Ocean's Gold, and I would add the BTT 2.0 tablets. And for the AFib, I'd give him glucogel. And
type 2 diabetes.
Yeah, for the type 2 diabetes, he needs to have some sweeties. And for the weight, he needs ASAP.
Perfect. You get an A+. Okay, so William, again, as Shar said correctly, you need, as a basic, 2 healthy brain and heart packs per month, a full dose of everything twice a day. You need to also get the Ocean's Gold. I'd go ahead and get 3 bottles of Ocean's Gold, so you can have 3 of those 3 times a day. And Ocean's Gold has a sea cucumber in it, which is now legendary for supporting your immune system when you have cancer and other terrible chronic diseases. And let's see here. AFib, as Shar said, is not a heart problem. Doctors will gladly run up $500,000 worth of heart procedures when AFib is really due to a back problem, okay? And so you need the glucogel. As she said, I'd go ahead and get 2 large bottles of glucogel, so you can take 15 of those a day, 5 at breakfast, lunch, and dinner. And the idea here is to support and promote maintenance repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, very important here, because the disc between key 1, 2, 3, and 4, the first 4 thoracic vertebrae, are going away or getting thinner, degenerative disc disease, the vertebrae are getting closer together, and they're squeezing the roots of the spinal nerves that actually control the rate and rhythm of the heart. And that can be, you can give the body the right raw materials, and it will support its ability to heal itself. The body wants to heal itself. In type 2 diabetes, I'd have you go ahead at 225, I'd get 3 bottles of our sweeties. So you can take 3 at breakfast, 3 at lunch, 3 at dinner. Make sure you're taking your fasting blood sugar every morning before you medicate yourself, as your blood sugar will drop. You need to change your dosage. And Shar is quite correct to get yourself 1 bottle, which is a liquid or the dropper dispenser of ASAP, an acronym for as soon as possible, and go ahead and put a dropper full under your tongue 30 minutes before each meal. It absorbs your oral tissues. It will not hurt you if you swallow it, but you won't get maximum benefit, so you do want to leave it absorbed through your oral tissues. And that's put 1 dropper full, not a drop, but a dropper full under your tongue 30 minutes before each meal. And call us every couple of weeks. We need to know what your blood sugar is, your blood pressure, let us know what your pulse is, let us know what your weight is, and whatever, anytime your doctor examines you and give you some status report on your prostate cancer and AFib and diabetes, and let us know what's going on. We'll walk you through this. Okay, Doug, let's go to callers.
Let's head to Guam. And Robert, you're on with Dr. Wallach.
Thank you.
Hello, Robert. You're on the air.
Yes, thank you, Doc. I'm calling on behalf of my wife. She was diagnosed with endometrial cancer last December. And we don't want to go to surgery. And we've been researching a little bit, so we would like to get your advice on what we can do to kind of arrest that maybe or reverse it.
Okay. First of all, does your wife have any other issues? Any heart disease, high blood pressure, arthritis, diabetes, anything like that?
No.
Okay, good. How old is she?
She's 53.
53, okay. And how much does she weigh?
She weighs 150 pounds.
150 pounds, okay. And how tall is she?
She's 4'11".
Oh, 4'11", okay. So at 4'11", yeah, I'd like to see her weigh 95 to 100 pounds. So she needs to lose 45, 50, 60 pounds, depending on her bone structure and stuff. So you need to lose some weight here. Okay. Got your immune system going. And she doesn't have any other issues, as we said, right? No diabetes, no heart disease,
no.
Nothing of that nature. Okay, good. All right. Shar, what would you do for this nice lady, Robert's wife? What would you do for her? She has a history of endometrial cancer. The doctors want to do surgery. They want to look at other options. What would you do for her?
I would get her on a gluten-free diet first, because that'll help her lose weight also. And I would give her 2 healthy brain and heart packs. I'd give her the Ocean's Gold, and I would give her the Fucoid Z, and the 2.0 tablet, the BTT 2.0 tablets for the auric point.
Absolutely. Mm-hmm.
Very good. Then she could take the ASAP to lose the weight, and as she loses the weight and gets rid of her cancer problem, she could cut back on the dose to a single bottle, single pack a month.
Sure. Okay. Well, endometrial cancer is one of those things where you have to make a choice. The doctors, if you catch it early enough, it's confined to the lining of the uterus, and if they want to do a hysterectomy, that's their sort of their approach to it, and you want to ask them what to expect for that. Is it at the point where they could, they can't guarantee 100%, but they can say you have a high probability that we will have cured it by giving her the hysterectomy. Has it gone to lymph nodes in surrounding pelvic areas? In which case, it's gotten out of the uterus and is more dangerous. And so those are things you'll have to discuss with your doctor. But Char's exactly right. To support your wife's immune system, regardless of what decision you make, whether you're going to have the surgery and chemotherapy and radiation or not, regardless, I would have her take, as Char said, 2 healthy brain and heart packs per month, a full dose of everything twice a day. And also have her take the Ocean's Gold, 3 of those twice a day. That'll be 2 bottles a month. So she can get the sea cucumber, which is legendary for supporting the immune system when you have cancer and other really serious life-threatening diseases. Also, you want to get her the Fucoid Z, which is a capsule, and she can take 5 of those twice a day. And apologize, you'll have to get the count in the bottles and figure out how many bottles you need of that. That's going to support her immune system. It's legendary. It has Fucoid in it, and it's legendary in the Japanese community because they eat so much of this red marine algae that has Fucoid in it. There's 850 studies on it in cancer therapies and supportive cancer therapies. Very, very good results. And then, of course, the Beyond Tangerine 2.0 tablets, as Char said correctly, I'd get her 2 bottles a month of that and have her take 3 of those tablets at breakfast and 3 at dinner time. That's going to give her 320,000 ORAC points. 3 once a day will give her 120,000 ORAC points. 160,000 ORAC points. And we want to get her over 100,000. And this is going to support her immune system and reduce the effects of free radical damage and so forth, which is something you want to do anytime somebody has cancer. That supports her immune system. And do give us a call. Obviously, if you want to have her lose weight now, or if you want to wait, if the finances won't cover everything, I'd go with the support for her immune system, which is because the cancer can be life-threatening. And she will lose, as Char said, she's going to lose some body weight here based on this and getting rid of the bad stuff, the fried foods, the processed meats, and all the gluten. But also, if you want to get rid of that weight now, she can have the ASAP, as Char says, and we got to get her 1 bottle a month where she can take a dropper full under her tongue 30 minutes for each meal and let her absorb her oral tissues, and she'll begin to lose anywhere from a half a pound to 2 pounds a day after a couple of days. And give us a call every couple of weeks. Let us know how she's doing, Robert. We'll walk you guys through this. Okay, Doug, we have time to start another one. Well, that answers that question. Well, stick with us. We'll be back with more Truth, Justice, and the Longevity Way after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity Night for Life Crusade. And Doug, let's go to callers.
So let's head to Aptos, California. And Lynn, you're on with Dr. Wallach.
Well, Lynn, you're on the air.
Thank you. Dr. Wallach, I have a question about bipolar and schizophrenia. I have a family member who had a history of drug abuse, been clean for about a year, maybe over a year.
Now, is this prescription drug abuse or is this street drug abuse?
Street drugs.
Okay.
And they have started having a lot of depression and starting to see things that aren't there. Mm-hmm. And I'd like to try to help them. I know sure. I have read Epigenetics, and I have read Dead Doctors Don't Lie, and so I've read the treatments, but some of the things I don't understand.
Sure.
Like some of the initials and stuff. So, if you
we only have a few minutes. Yeah, Lynn, we only have a few minutes here, so I want to get right in this to help you. how much does this guy weigh? Is it a guy or a gal?
Guy, 190, 6'2".
Okay. The brain requires all 90 essential nutrients, okay? And when anybody has depression, manic depression, bipolar disease, and bipolar disease is when you're in civilian clothes, when you're in a military uniform of any kind and you have bipolar disease, it's called PTSD, all right? Same disease. And then they give them drugs that one of the side effects is suicide, and then they wonder why they're all committing suicide, all right? And so these are simple nutritional deficiencies, okay? And so I guarantee you this guy has a lot of nutritional deficiencies. And so at 190 pounds, I would go ahead, and I'm sure he's on medication. Is that correct?
No.
He's not on any medication?
No, not yet. Because
not yet, okay.
We're trying to get him evaluated, but he's reluctant. So.
Okay.
And he
all right. Is he capable of working? Is he working?
Yes.
What kind of work does he do? What does he do?
He's in the restaurant business.
I'm sorry?
Food service.
I'm still missing that.
Food service, like eating.
Oh, restaurant. Food service. Okay, food service. Okay. So is he a waiter or a cook? Cook, okay. Yeah, and so basically, we can't get everything we need from our food anymore, no matter how good a chef he is and so forth. So he's got to get rid of all the bad stuff. No fried foods, no processed meats, no oils, no gluten. He needs to stay away from all sugar and all alcohol. And we have actually an energy drink and stuff like Rebound, which is a sports drink, has 100 nutrients in it. But a guy who's 190 pounds, 6'2", I'd get him on 2 healthy brain and heart packs per month, 2 healthy brain and heart packs per month, a full dose of everything twice a day. I'd also have him take the de-stress capsules, 3 of those twice a day for the brain metabolism. I'd have him take 3 of those twice a day. That's 2 bottles a month. I'd also have him take the Smart FX for neurotransmitter raw material. I'd have him take 9 of those a day, 3 at breakfast, 3 at lunch, 3 at dinner. It'll be 3 bottles a month. And then lastly, we have a new product called Synaptive. Okay, not Synapsys, but Synaptive. And I'd have him take 3 of those twice a day. It'll be 2 bottles a month. And it's designed to deal with cognition, problem-solving, socialization, designed to deal with memory, designed to deal with, again, neurotransmitters of the brain and everything. And I do want him to eat anywhere, at his size, I want him to eat, say 8 to 10 eggs a day. They have to be soft-boiled with a soft yolk or soft poached with a soft yolk or soft scrambled in butter, not oils or margarine. And this is for the raw material of the brain. Make sure he's not on any statin drugs, which will actually cause these kinds of brain disease, everything from Alzheimer's disease to Parkinson's disease, also things like depression and so forth, because 75% of the brain weight is cholesterol. Call us every couple of weeks. Let us know how he's doing. We'll walk you guys through this. Okay, thank you, Shar. Super job today. Thank you so much, Doug and Billy. Welcome back. And by golly, you guys do a super job as usual. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.
Fish has been thought of as a brain food for eons, but it's not the fish that's key. It's actually the essential fatty acids, EFAs, or omega-3s found in fish, called essential because they're necessary for good health and your body can't make them. So they must be consumed through diet or supplementation. Longevity has developed the perfect supplement in Smart FX, an acronym for Sustained Memory and Retrieval Time, a concentration of DHA and EPA, both members of the omega-3 family, supporting neural path function and cardiovascular health for optimal mental concentration, awareness, focus, and agility. If you've got a mentally demanding career, you're a student crunching for the big test, or just want to maintain health for a sense of well-being, try Smart FX from Longevity. If you'd like to learn more about nutritional supplementation, call your local Longevity associate, and don't forget to ask about home-based business opportunities.
If you've been diagnosed with type 2 diabetes, prediabetes, or the metabolic syndrome, and you're tired of seeing your blood glucose levels rise and fall like a ship on the ocean, but you don't want to take those drugs the rest of your life, Longevity has an alternative. A product called Sweeties has been developed just for you. Used as part of your regular diet, Sweeties helps maintain healthy blood sugar levels. A formulation specially designed to nutritionally assist your body with the regulation of your blood sugar level. Sweeties supports healthy glucose metabolism because it's fortified with aspartic acid, chromium, and vanadium, all to help you promote healthy blood sugar levels. If you want to get off those drugs and control your blood sugar metabolism naturally, try Youngevity's Sweeties product. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi everyone, Andy Anderson here. Are you using those handy little bottles of gel that zap germs, bacteria, and other nasties? In today's world, that's smart, especially with all the filthy doorknobs, shopping carts, and handrails we touch every day. Here's what you may not know. Once the alcohol evaporates, goodbye effectiveness. No more protection until you use it again. PureWorks to the rescue. Our FDA-compliant foam, lotion, soap, and spray do not rely on alcohol. Their killing power lasts up to 4 hours. PureWorks disinfecting spray is EPA certified to kill swine flu, bird flu, MRSA, HIV, hepatitis B and C, and a whole host of viruses and bacteria. Mold and fungus too. It's even safe around children and pets. You'll love the soft feel of PureWorks on your hand. It actually conditions and will not dry your skin. Here's a little peace of mind knowing your hands are still germ-free hours later. Get your hands on PureWorks and get PureWorks on your hands. Stand by. Pull out your paper and pencil for your local number to order PureWorks.
So you finally decided to start taking a vitamin supplement. Those chewables and tablets are fine if you don't mind paying for something that is only absorbed about 4 to 6%. However, a liquid supplement can have a 90% absorption rate if you choose the right one. Youngevity offers a wide variety of liquid supplements with a 90% absorption rate or more. Beyond Tangy Tangerine may be the best one ever invented. It starts as a liquid, then is freeze-dried like those instant coffees into a crystal. Then all you have to do is add a couple of scoops to water. No refrigeration, no fuss, no mess. Not only do you get a complete multiple vitamin, Beyond Tangy Tangerine also has minerals, and it tastes fantastic. You'll want to drink it all day long. So the next time you reach for a vitamin supplement, reach for Beyond Tangy Tangerine from Youngevity. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
With increasing rates of osteoporosis, it's becoming more and more evident that most Americans have low blood levels of calcium. Some would say,
I get all the calcium I need from dairy products.
Unfortunately, that's just not true. Besides, most dairy products are homogenized and can contain steroids and antibiotics that kill off good bacteria in the digestive system. Not to mention, the human body needs magnesium to make use of dietary calcium. That's why Youngevity developed OsteoFX Plus, containing bioavailable plant-derived forms of vitamin D3, calcium, magnesium, zinc, copper, and glucosamine sulfate. OsteoFX Plus is formulated to support healthy bones and joints. Not to mention, OsteoFX Plus tastes great, unlike other products that taste like chalk or dirt. If you'd like to learn more about nutritional supplementation, call your local Youngevity associate, and don't forget to ask about home-based business opportunities.
You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
I am Judy DeVilbus. Here I am speaking to you again. I just wanted to tell you that recently I started drinking the Whey Shakes again, the chocolate Whey Shake. And you need to remember, the Whey Shake isn't just for losing weight. It's a fantastic place to get your great protein. And if you're trying to gain weight, you can take it along with your meals. And the best part is, if you want to just have a great protein shake, do like I do. Put it over ice, stir it up, and you can sip on it for 20 minutes to an hour. I do it every single day. I absolutely love it. You need to get back to it too. It's really good for you. And it makes not fat, but it makes muscle after you work out. And you can also mix it up in a blender with an egg, and you have the most incredible health protein shake. Or mix it with a little water, stir it up, and you have a little pudding. And who doesn't like pudding?
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities. You've listened to physician and veterinarian Dr. Joel Wallach help many people on the Dead Doctors Don't Lie talk radio program. You've also heard hundreds of people tell how Dr. Wallach and Youngevity products have changed their lives. If you're now convinced that Dr. Wallach is onto something and you want to try Youngevity's premium quality products for yourself, we can connect you with a distributor that serves your local area. Simply call our special helpline voicemail at 313-444-3463. That's 313-444-3463. Call right now and leave your name, telephone number, or email address, and we'll see to it that the right person contacts you shortly. Remember, the phone number, 313-444-3463. That's 313-444-3463. Call now to change your life. That's 313-444-3463.
Hi, this is Dr. Joel Wallach, your host of Dead Doctors Don't Lie. If you're interested in a colon cleanse, blood cleanse, liver cleanse, in the classical herbal way, you want to ask your Youngevity associate for Herbal Rainforest. Herbal Rainforest has 16 herbs, 16 cleansing herbs, classic cleansing herbs, and 77 plant minerals. That's right, and these are all organic. It doesn't get any better than that. In your busy day, and you're around all these toxins out there in your workplace, on the way home, going to work, in your food, in the air, in the water, you need Herbal Rainforest. I guarantee you, it will give you a cleanse. You can control the dose. It's a liquid. It tastes good. It doesn't get any better than this. A colon that's happy makes you happy. Nothing better than a happy colon. Herbal Rainforest. Clean it out.
For more information on this product or others you've heard about on the Dead Doctors Don't Lie radio program, call your local Youngevity associate today. And don't forget to ask about home-based business opportunities.
Greetings, everyone. Judy DeVilbus here. What do you think of when you hear the words tangy tangerine? Well, I think of like a sweet, tangy tasting something. Well, what I'm referring to is the Ultimate Tangy Tangerine. It's a fantastic product. It has everything you need, and a great benefit is it's very, very delicious. It's very easy to drink. I've suggested it even to youngsters. Even children like it. Even little guys. Even little girls. They come right into my office. Their parents can't get them to take those chewables, and besides that, they're not as good as Tangy Tangerine. And I give them a little taste of that, and you know something? They're pleased as punch. So, if it's good for a child and it tastes delicious, why not you? There's no excuse not to take a vitamin when it tastes as good as that does. So how about it? Tangy Tangerine should be the answer to all of your nutritional program problems.
For more information or to order, call your Youngevity distributor today. And don't forget to ask about Youngevity home-based business opportunities.
This is the ZBS Radio Network.